My name is Eric Leuthardt. I am an associate professor of neurosurgery, biomedical engineering, and mechanical engineering at Washington University School of Medicine. Primarily, I'm a neurosurgeon who takes care of patients with brain tumors and epilepsy. In addition to that, I also had a laboratory. I run a biomedical engineering lab, which focuses on creating brain-computer interfaces and really decoding how the brain works and figuring out applications for that, with the hopeful goal of improving technologies that help people with disabilities, as well as creating better brain mapping technologies for patients with brain tumors. Again, the core principle of my research is all about decoding the brain. How do you understand how the brain encodes information and what can you do with it? So on one side, decoding the brain means a brain-computer interface, basically taking some type of device that can decode your thoughts and use that to allow a person to control things with their thoughts alone. Now, whether it be a patient with a spinal cord injury to improve their ability to communicate, or a patient with a stroke to help them recover function such as a paralyzed hand. That's one side of it. On the other side of it is if we can decode the brain and know where the function is, then we can avoid those areas when we're taking a brain tumor out to better preserve function with surgery. The field is actually moving fairly rapidly. Just 10 years ago is when we really first demonstrated that we can use brain signals to allow a person to control a single cursor on a screen in one direction. Now, today, you have patients with spinal cord injuries who actually have implants that allow them to control robotic arms. We're currently in clinical trials using brain-computer interfaces to help stroke patients recover function in their hand that they've lost for years. And also some of our brain mapping techniques are currently actively being used in brain tumor surgery every day of the week. The interesting thing about science today and medicine is that if you want to really learn and understand the brain, you actually have to learn a lot of other things too, such as being good at math. So a lot of the stuff that we do to create a brain-computer interface, to create thought-controlled devices, is being really, really good at math so we can decode or decrypt brain signals. It's almost like this coded language, and to decode that language of the brain, you have to have really good math skills and computer skills. So I think math, science, and engineering are all kind of coming together to create these novel technologies. I remember when I was in high school, actually, and how I got involved in neuroscience. I volunteered in a laboratory. And I think that just gives you general exposure to kind of what's out there in the world. I think that's one way to really kind of get your feet wet, really kind of give your time and your enthusiasm and dedication to people. Even if it's something as simple as cleaning beakers, you get exposed to what people are doing. I think as you think about programs, I think, again, taking, math and science seriously, really understanding those courses. And then as far as doing what I do, it involves studying engineering in either undergraduate or after college, and getting involved in medicine. Hard work is important, and your brain is like a muscle. And what I mean by that is that a lot of times people think, I'm not a math person, or I'm not a science person, or I'm not a this person, or I'm not a that person, I'm not a language person. And the honest truth is, with effort, you can be whatever type of person you want to be. You can develop the skills that you need by working hard at them. Just as you're not born a marathon runner, you have to train to become a marathon runner. And just as most people aren't born math whizzes, that you can train and you can learn to become a math whiz or a masterful scientist. And I think that just takes effort and consistent hard work.